And tonight, it's my absolute pleasure to welcome Professor Ian Brighthope to our live discussion. Professor Brighthope is a medical practitioner who graduated over 40 years ago with a Bachelor of Medicine and Bachelor of Surgery. He originally specialised in immunology, but he decided early in his career to focus on nutritional and environmental medicine. And he is the founding president of the Australasian College of Nutritional and Environmental Medicine. Now, I've been a fan of the work of Professor Brighthope since I first heard of his work back around 1990, it would have been. And having been to several of his talks over the years, I know the information that he's going to share with us tonight will be of enormous value to everyone. Tonight, Professor Brighthope will discuss the research behind vitamin C, vitamin D and zinc. And he will also address the efforts that he's made to campaign widely to try to get our government to consider introducing preventative protocols and evidence-based natural treatment options for COVID-19. That kind of makes sense, doesn't it? And hopefully he'll be able to give us some insights as to why our government just isn't listening to his incredible expertise and why the current protocols that we're using now are being pushed. Welcome, Professor Brighthope. Thank you so much for joining us tonight.
Thank you very much, Molly. It's my pleasure to be here with you. And I hope we can impart some knowledge and wisdom to those who are on Facebook with us.
Yes, I'm sure we will. Now, Ian, we've really already received many questions from emails from my patients and from people in the community. So there'll be quite a few questions at the end of this, so I hope you're up for that.
Sure.
I'd like to start off tonight. I wanted to ask you about your journey from being a medical doctor to becoming such a great advocate for natural medicine. So can you tell me how you made that transition, and has the journey been smooth or has it been a bit, you know, rough and difficult at times?
Well, I first did a diploma in agricultural science and read some research into foods and nutrition in animals. And that exposed me to the importance of trace elements in particular in the soil, and also natural fertilizers compared to synthetic fertilizers in the production of crops and pastures. And it was also interesting to observe that reproduction in animals was very dependent on nutrition. And in fact, I was involved in a study to do with reproduction, facilitating reproductive rates in sheep. We found that supplementing the sheep during mating season actually produced more healthy lambs and increased twinning in lambs. So other issues around the production of white muscle disease in cattle and sheep, a selenium deficiency, and with that, the observance of cardiomegaly, or very large hearts in these animals that were starved with selenium. And I mean, this didn't make sense to me in terms of human health until halfway through my medical career, when I left agricultural science and went into medicine. And I was very disappointed in medicine in my training, because there was very little in the way of the study of nutrition in health. And in my fourth year, I asked a professor of medicine about a particular patient lying in hospital, an elderly lady being drip-fed sugar and salt and given jelly and ice cream as a meal. I asked about her diet because she was wasting away. And the prof said, "You don't worry about the diet, her diet's okay, we're talking about her cancer." Well, you know, that changed me completely. I said, I'm not going to be a doctor like that. But I found it very difficult after I graduated to do anything different, until I was exposed to a very small group of like-minded doctors who had formed an association, or were in the formation of an association. And I joined them and finalised the constitution of this organisation. And it was very basic after that I was feeling fairly comfortable. I had colleagues who were aligned with me in looking at nutrition and supplementation of people to prevent and treat illness and disease. So it was a very interesting start, because I I was not happy with the way medicine was being practiced. In particular, just giving drugs and chemicals to sick people without looking at their diet and their lifestyle and exercise and so on, and filling them up with sugar and salt and fats and so on. It was very, very against what I'd been brought up as a kid with my grandparents, who believed in, you know, in garlic and growing their own cod liver oil or whatever.
Yes.
So we started an organisation called the Australasian College of Nutritional and Environmental Medicine in the early 1980s. And from there on, we actually looked at all the research that was available. We ran courses for doctors and other healthcare professionals as well. And that organisation, since early 1980s, is flourishing up until today, and is getting stronger and stronger. So yeah, but it's been a rough journey sometimes, because as the founding president and president for a long time, I was the focal point for the medical authorities, who didn't like the fact that some doctors were not prescribing medications when they thought they should be. I'll put it very diplomatically and succinctly.
Yeah, it's I mean, I know I've been working as a herbalist since 1983, and my journey would be nothing like yours, but there's been a lot of rough journeys along the way with authorities that just don't like what do we do.
Well, it's medicine is meant to be a profession, but the medical industry, and that includes everything from medications to hospitals to clinics to pathology and investigations and procedural work, is a very, very big industry, a very powerful industry. And if we reduce the amount of illness, sickness and disease in the community, then that industry contracts, and a large number of the population are dependent on working in the industry. However, I do believe that there's a lot of work to be done in prevention and health optimization. And what I believe is the utilization of the tools that we have now to produce super health, optimal health, or even patients who are very sick, to optimize their well-being so that they can have a greater chance of beating their illness and their disease, and you know, being productive members of the community. And my colleagues and I have seen literally thousands of people achieve this, whether they go to a nutritionist or a natural therapist or a herbalist or a doctor practicing nutritional and environmental medicine. All of these things should be integrated, and that's another story about the integration of all of these modalities for the benefit of the community.
Yes, it's the bigger picture is integration and caring for each other rather than the dollar, really. But that's where we're at right now in our healthcare system, certainly. Ian, I wonder if we can jump in, and can you talk to us about vitamin C? Because I know the work you've done with vitamin C, and particularly intravenous vitamin C over the years, has been quite amazing. So can you talk to us about vitamin C? And I know that there are lots of different forms of vitamin C, and it can be quite confusing, you know, which one should you take? Is one better than another? And now we've got liposomal vitamin C. So, you know, how do people make a choice around what they take? Is one better than the other?
Look, I guess I'm talking to the members of the general public more than to herbalists and doctors. Is that correct?
I think we're a bit of a mix, because there's a lot of practitioners who certainly would be viewing tonight, but there's certainly a lot of the public as well. So,
well, I mean, basically, when we look at vitamin C, it is really not a vitamin. It's an acid, an organic acid. And most animals, apart from the human being, the higher apes and the guinea pig, and maybe a couple of other animals, most of them produce vitamin C in the liver from glucose, from simple sugar. We have evolved a very large brain that requires all that sugar, so we don't make vitamin C ourselves. That's very, very simple. We've lost the enzymes to make our own vitamin C. We have created an environment for ourselves where we've come out of the caves. We're not eating natural organic food any longer. We don't have access to high levels of vitamin C in our diet, and we don't make it. When we're under stress, we tend to produce things called free radicals, or reactive oxygen species. And these free radicals are very dangerous molecules in the body. They are oxidation substances that cause us to oxidize, cause our fats to go rancid, and cause our water-soluble compartments to go rusty, if you like. So this is a natural part of aging as well. But when we're exposed to medications and radiation and drugs and trauma, surgery, inflammatory disorders, a whole range of things that actually cause the production of these free radicals, we need antioxidants to mop them up. And I don't like the term antioxidant. I prefer the term a redox reagent, something that actually takes these radicals and neutralizes them and pulls them away from your system. And the best substance that we have organically for that is vitamin C, or ascorbic acid. It is actually the cleaning agent that cleans out all of these radicals that we collect in our systems. And because we don't make it, and because our diets are often deficient in a whole range of nutrients, it's important to make sure we've got this redox system, or this antioxidant system in our bodies and functioning well. So this is why I advocate the use of vitamin C to everybody as a supplement, so that if you are under stress or exposed to diesel fumes, or you're taking medications that produce oxidation species, that you can actually ensure that you are going to mop them up so that they don't do any damage. And 1 to 2,000 milligrams of vitamin C per day is wise for all adults. Some people may need more for wellness, and if you get a cold or a flu, then you have to increase it. One of my colleagues in the United States used to talk about a 2-gram flu, or a 10-gram flu, or a 20-gram cold, depending on how much you needed to feel well. The most important thing is, if you do catch a virus, the first thing you do is increase your intake of vitamin C and take it every hour until you feel better, or until your bowels start rejecting. I mean, people talk about the side effects of vitamin C. The side effects of big doses of vitamin C are wind, loose bowels, and chronic good health. So those 3 side effects, one of which is highly desirable, is worthwhile if you're going to prevent yourself from suffering from a severe cold or a severe flu-like illness, or any viral illness for that matter, because it has antiviral activity. It's a wonderful molecule because it works at so many levels in the body. It works for detoxification. It works on the immune system to actually help the white blood cells to kill viruses and bacteria and fungi and this sort of thing. It even works on the central nervous system and reduces the oxidation and inflammation that occurs in the central nervous system. So supplementation orally is what I recommend for everybody. Now, this is not a medical recommendation for everybody out there. I recommend you go and see your health practitioners who know about this for the best advice. And you mentioned liposomal vitamin C. Liposomal vitamin C is better absorbed than some of the other forms of vitamin C. It's more expensive, and if you can take the liposomal vitamin C, then by all means it is better absorbed. But whether it's more effective clinically or not, there is no hard evidence to that effect. There's the other forms of vitamin C are ascorbic acid, the acid form, or sodium ascorbate, a salt. Magnesium ascorbate, which is magnesium combined with vitamin C, calcium ascorbate, calcium combined with vitamin C. You can take mixtures of all of these, and quite often you find those mixtures in tablets and powders in health food stores and pharmacies. And of course, go on.
No, I was just going to say, what actual action does vitamin C have against viruses? Is there something specific that it does?
Yes, it does have a direct antiviral effect. It does change the nature of the coat of the virus, the protein coat, if you have significant levels and concentrations in the blood. But more importantly, if the virus has got into your system, it actually potentiates the effects or improves the effects and activity of your white blood cells, of your lymphocytes. The white blood cells are the cells that fight bacteria and viruses, and they engulf them. The white blood cells take the bacteria and viruses into their cytoplasm, into their plasm, into their body. And in there, they have little bodies that actually produce hydrogen peroxide, and vitamin C potentiates the production of hydrogen peroxide. And vitamin C becomes a radical itself. So it actually acts as a very powerful oxidizing molecule. It's fascinating that it can act in so many ways. And so the white blood cell can actually kill off the virus by producing hydrogen peroxide, which is a very, it's the bleach that you use to put on your hair and so on, is a very powerful oxidizing substance, H2O2. The oxygen there really is something. It becomes a radical, and the electrons in that radical just fire at the virus, and it's gone. It's dead.
Zap it. Yeah, so it's certainly something that I've used a lot in practice, and it's little used in, well, certainly not medically, is it? They don't even think about it, and it's really sad because it's such a vital vitamin for human health.
Yeah, if you go for 54 days without vitamin C, you end up with a disease called scurvy, which is the where you start getting very easily bruised and bleeding. You bleed from the gums. You bleed. Old wounds open up or dehisce and start bleeding, and you eventually die from scurvy. And that was discovered by a fellow called Walter Lind on the HMS Salisbury, a ship at sea. He did a study where he gave the seamen who were suffering from scurvy, he fed them pork, he fed them vinegar, he fed them saline from the sea, and he fed them the juice of limes. And that's how the cure for scurvy came about, because there was something in the limes, and of course in limes and other citrus fruits you've got vitamin C. But we're walking around, many of us are walking around with subclinical scurvy, and that means we don't have enough. This is why we feel tired, we feel aches and pains, we get this furrow in the brow, this grey complexion. You don't look very well at all. It's a significant number of people I see in Collins Street from time to time.
Yeah, that's interesting, isn't it? Yeah. The fatigue aspect is interesting because most people are tired. They're definitely tired.
Well, it's a natural thing to get tired, but at the right time, not during the day. Yeah. And then there's the other sodium ascorbate that we use in large doses intravenously. And this is when somebody is ill, and it doesn't matter what they're ill with, because any illness will produce reactive oxygen species or free radicals, and they need to be controlled, they need to be mopped up, and they need to be sunk away in either a thing called glutathione, vitamin E, or some other compartment of the body where they can't do any more damage. So the vitamin C sits in the middle. It takes the electron from the free radical and it gives it to vitamin C, and vitamin D or glutathione, some other pathway in the body that actually mops up the rubbish. It's like a whole lot of dust and dirt in your house, causing havoc inside. You've got to get rid of it. So the vitamin C is there at the doorway. It picks up all the dust and pushes it out into your rubbish bin.
Interesting. It's a broom. So you mentioned vitamin D. So let's talk about vitamin D. There are a couple of different forms of it. Again, what's the difference between D2 and D3? And is there a better form to take? And is it something that people should take all the time, or just when they're a bit crook, or just during winter? What's your thoughts on that?
In this context, the best form to take is vitamin D3. No other. The body makes vitamin D by exposure of the skin to the sun, to ultraviolet light B or UVB. And the molecule in the skin that is used is cholesterol. So if you've got cholesterol in the skin, the UVB light falls on the cholesterol and converts it into a different form of cholesterol, which is a precursor to vitamin D. This precursor goes to the liver. It's acted on by the liver, and you've got to have a healthy liver. It goes to the kidney, and the kidney then converts it into its third stage, and that is vitamin D3. And that is the active component in the body. Vitamin D3 is not a real vitamin. It is now classified more accurately as a hormone, because very small concentrations of it have a profound effect on so many aspects of our well-being and health. Not just for healthy bones, not just for healthy skin, hair and nails and teeth, but it has a very important role in the immune system and defending us against not only viruses and bacteria, but also certain hormone-dependent cancers like perhaps prostate cancer and breast cancer. So it's very, very powerful and important molecule. It's basically like taking the energy and the information from the sun and delivering that information to the deepest cells within our being. And every cell in our body, including the cell membrane and nuclear membranes that hold our chromosomes and genes together, have got receptors for vitamin D. So in that respect, it's a very powerful and ubiquitous molecule. It's everywhere. It's so important to have enough of it in our systems. Just like the vitamin C. This is why I've elected to look at a campaign with regard to helping us defend ourselves, not just against this virus called COVID-19 or SARS-CoV-19, whatever classification. Most people just refer to COVID. But the next pandemic, and the pandemic after that, and the pandemic after that. And this is not new. Cod liver oil has been known for centuries to prevent these outbreaks of infections. And even during the plague in Melbourne and Sydney, the turn of last century, from 1800s to 1900s, people died from the plague, but those who did better and survived were the ones who were taken out of their beds and put into the sunshine. The same with the TB sanitarium. People have a balcony in the hospital so they can take patients out and put them in the sunshine. That's when you get the better results. Why? We know now it's vitamin D. And we know so much more about it now than we have in the past. So D3 is the best form to take. D2 is one of the intermediaries. Most of us as kids, back in my generation, we got cod liver oil during the winter.
Yep.
Father and mother, yeah.
Yeah. It was disgusting. It still is, actually.
Well, we had, for our kids, we had halibut liver oil capsules because they were more potent in vitamin D and vitamin A than the cod liver oil. 4,000 units of A and 400 of D. So they'd pop 2 little of these capsules in their mouth. Virtually no infections in no antibiotics. My kids, basically healthy all the way through. It's sad, Molly, that it really is sad that we have moved away from nature and we require synthetics from our medical professionals who should know better. But they don't because of an attitude. The attitude being, you get sick, you go to the doctor and he'll fix you up. And we've got all of these marvellous medications. Well, we are par excellence in terms of acute interventive medicine in Australia. We've got the best doctors, the best hospitals, the best equipment and so forth, or so we think we have, and so we say we have. But we do have a very, very good disease care medical system. But we have a lousy health. We have we don't have a healthcare system. You've got to do your own healthcare yourself in this country. Like go to a nutritionist or a natural therapist or a herbalist or a doctor doing nutritional medicine, and you have to pay for it, and it's not rebated. Whereas doctors like yourself should be rewarded for keeping people healthy. And but the illness system requires a certain amount of disease. And that's a fact of life. And this is why we're in the situation we are now, because there's been, despite the fact that there's a huge amount of research in vitamin D and vitamin C and zinc, what we're talking about tonight, massive amounts of basic research. But all we need is intelligent people like yourself and and our colleagues to actually translate that information into practical use. Translational work is so important. If you see somebody with a deficiency, you correct the deficiency, or low levels of nutrients, you correct them. You know, we don't wait for a double-blind placebo-controlled study for every individual with a disease, because we'll never have them. And we need to be pragmatic and practical and also very safe, effective, and ethical in our dealings with the people who are listening to us tonight. I'm sure most of the people listening to us tonight do appreciate the importance of self-help and taking responsibility for their health.
Yes, I think, and the old first do no harm is hidden a little, isn't it? Ian, just with vitamin D, so if we go out into the sun, can we get enough to keep our body going? And I would think that by using all the sunscreens, we're actually counterproductive to what we need from the sun with our health if we're covering up our body with chemicals. But can we get enough just by going out in the sun in summer, for instance, to last us through winter?
Well, in ideal conditions, no, we can't. We can't do that. Because we've moved away from, good sunshine and reliable sunshine. We've moved, either far north from the equator and south of the equator. As human beings, we've migrated away from those parts where we get a lot of sun. Although Tasmania gets a lot of sun, a lot more sun than Victoria, but it's too cold to go out in it. We live in caves. We're even worse off than the cavemen, because cavemen left their caves and went out and foraged for food. We go from one cave, our home, to another cave, our office or workplace. So we very rarely see enough sun. We need more. We need half an hour, and we need to expose our arms, our legs, and our face for a reasonable period of time when the sun is at its zenith or close to its zenith, without being burned. And a young white male can manufacture up to about 20,000 international units a day by doing that. The amount that we have allowed in this country to take as a capsule is 1,000 units. So supplements are very low in dosage form here. There is another supplement you can take once a week, 7,000 units, but it's still, that's only 1,000 units a day, and it's pathetic. Dark-skinned people and people who cover themselves with a lot of clothing and don't expose themselves, certain sectors of the community, like female Muslims, they don't expose their body to enough sun to get any vitamin D. And relying on your diet for it, from meat and eggs and milk and oily fish, is just not enough, and it's not scientific these days. When we know that the majority of the population in many countries are low or deficient in vitamin D, we should be doing it more scientifically, and that is measuring the amount they've got in the blood, because that's an indicator of what they may need. And to get somebody up to normal, you may need to give them 5,000 to 10,000 units a day to get them to a level of vitamin D in the system that's going to be protective against acute viral infections and give them optimal levels. Long-term doses of 50,000 units or higher may produce some forms of toxicity, but 4,000, 5,000 units a day during the winter will protect you against a lot of infections. And we know that the doctors that I work with and my groups around the world, and we're not just a group in Australia, but we've got people everywhere in nutritional medicine now, including even in China, they are all in agreement about the dosages and the forms that I'm talking about tonight. So it's not just an idea that I've got. It's basically very well established and entrenched in nutritional medicine. And I think we don't get enough from our diet, and in many countries around the world, officials in many countries around the world, including Europe and UK, agree that supplementation is important. People over the age of 65 in Germany get this from the government. In the Scandinavian countries, most people supplement. It's not a decree by government either, although some governments insist that people supplement. Even in England, Scotland and Ireland now, Great Britain, the governments are telling people to consider supplementing with vitamin D because of the evidence that it's effective in immunity and COVID. I don't know what the question was now, but
going out in the sun, getting enough. I think we're way behind the times down under here with what to do with nutrition.
Well, even a colleague of mine in India has got philanthropists supplying vitamin D to the poor in India via the Red Cross. The government in Egypt has supplied vitamin D to all of the frontline healthcare workers.
Makes sense.
Yeah, it does. It makes a lot of sense when you
makes sense.
look at the overall literature. But it's not just looking at the medical and scientific literature, Molly. It's actually listening to the people out there in the front line who have actually had the experience. And I'm not talking about just one generation. I'm talking about 40 years, 50 years of experience. High level experience in clinical practice that people have been doing this. But still, there is this massive pushback from authorities.
Well, big pharma, the dollar, big business. Yeah, it's very frustrating. I've always found it very frustrating. Okay, so a couple of thousand milligrams of vitamin C, 4,000 or 5,000 milligrams of vitamin D. What about zinc?
Sorry, units of D.
Sorry, yes.
And
milligrams.
D is measured in micrograms, but just think about units. 4,000 C, 4,000 milligrams of C, 4,000 units of D. This is for the period during going through COVID, and of course, if you do know, if you've got anybody in a nursing home or institution, make sure that they get their vitamin D, and even go to the administration of these organisations and say, look, we've had deaths in these institutions. You should be given advice to supplement your elderly people. If you don't want to supplement, then at least measure their blood levels, because if you find that their blood levels are low, then they will need supplementing, and there's a legal requirement. You will, if somebody is in an aged care home and they're deficient in vitamin D and they die, I think the management, the ownership of those organisations and the medical people responsible could be culpable. So
good to know.
I think there's going to have to be, I think, accountability applied to various organisations around the world. And that's all I'll say about that, because we rely on our governments and health departments and training organisations for healthcare practitioners and the World Health Organization for advice. And I must say, there's been a distinct denial of effective therapies that we were talking about tonight by these organisations, and for the sake of humanity. We have been let down by the World Health Authorities as a race, as human beings. We deserve better. There's no antiviral agent that affects these viruses, and always the vaccines are like the cart before the horse, or the stable door. The horse is bolted. You close the door stable door after the horse has bolted, you try and do something after the event with the vaccine, and it's just not good enough. I mean, I'm not being overly critical, I'm being realistic about this. We have information, we have enough information to defend ourselves against these viruses. And even if it's 50% effective, or 20% effective, or 10% effective, we will save lives. Why? Yes. Why are we continuing to watch the authorities and ignoring the pleas? And I've actually sent letters to the authorities pleading with them to make some announcements. And the next day I find somebody on television is crying on television because they've lost their gran, simply because gran was in a nursing home or in an institution, and she didn't have her vitamin C and vitamin D levels measured.
Ian, do you have an idea or a thought about why the WHO and the authorities are taking this stance? Why do you think? Because to me, it makes no sense that they would do this.
Well, it's an attitude. As I mentioned before, I think we grow up thinking that the doctor's going to heal everything for us. And then we'll go to the doctor, we'll get an antibiotic, and we'll get some cortisone, and the problem will go away. But doctors are trained to think and act in terms of disease. They're not trained to think and act in terms of prevention. I mean, statins, for example, patients who've got cholesterol, there are far better ways of dealing with impending cardiac problems than giving somebody a statin. And I won't go into that now, but or anti-inflammatories for inflammatory disorders. There are naturally occurring anti-inflammatories, such as curcumin, for example, and just changing one's diet. I mean, these are very simple approaches, or even just some exercise for inflammatory disorders. But this is not, it's a little bit harder than just writing a prescription. And I think we've lost contact with nature. We certainly have lost contact with nature. And we only command nature by obeying her. And many of the things that we're doing, we're disobeying her with the way we live, the sedentary lifestyle, the alcohol, the tobacco, the synthetic drugs, the sedentary lifestyle. There's so many things that humanity is doing to destroy itself, and we're doing it at a very rapid rate. And we've got to put a brake on it. I think there's a consciousness now, like there was a consciousness in the 1960s when I grew up. There's a consciousness now amongst, especially the younger people, that we've got a planet. We've only got one planet to live on, and we're destroying it, and we're destroying it at a rapid rate. And these people who think we can go to Mars and live, I mean, they're almost. I mean, to me, that's almost schizophrenia. Schizophrenia is a denial of reality, delusions of grandeur. Believing things that are there that aren't really there. And it really is a form of mind illness, if you like. And many of the authorities have got this. And it's almost infantile the way they defend the positions that they take, when logic tells us that there are different ways. And I tell my students that you don't follow your leaders, and don't listen to your leaders, including people like myself who might think they're your leaders. You use your common sense. You always ask the questions and dig deeper. And that's when you find the truth. But I have forsaken governments around the world. We need better leaders than what we've got, because when this whole thing with COVID started, we were told it's a pandemic. Yes, it is, but it's just it's not as bad as the next one it's going to be. This is just a dress rehearsal for the real one. And we're going to shut everything down next time as well. I don't think so. We were told it's a war and that we're going to be working all together and be inclusive. Well, as far as being inclusive is concerned, people like me around the world have been totally excluded from decision-making by government and healthcare authorities. I mean, are we crazy? I don't think so. I've got hundreds of thousands of articles dealing with healthcare in another way. And it's to do with, a lot of it's to do with nutrition, a lot of it's to do with the environment. You know, why did the people in northern Italy have such a high death rate? One, they were elderly. Two, they lived inside. Three, they were very close to freeways and or pollution. Four, they smoked. Five, they drank too much. Six, many of them were on ACE inhibitors, blood pressure drugs. I can go on.
It's a cocktail, isn't it?
And, yeah, and you know, the underlying thing, of course, is that they're low in the very important building blocks to support their immune system. Not boost their immune system, just support it at a basic level. C, D, and zinc, etc.
The basics, yeah. What about zinc? Ian, talk to us about zinc. What do you recommend there?
Zinc is a very important trace element. It is quite often deficient in populations that have high intakes of refined carbohydrates, such as sugar, white flour products, and alcohol, because it's washed out of the system. It is involved in over 300 different enzyme reactions. It's a cofactor for enzymes in our body, and enzymes are proteins that make the chemical reactions in the body work faster and more efficiently. And so if we don't have enough zinc, then these reactions, these enzyme reactions, just don't work very well. And that it applies all the way through to our genes and our chromosomes. Our genes and our chromosomes require zinc-dependent DNA repair enzymes, so we can repair any mutations in our genes. If we have a mutation in our gene, we don't produce the right sorts of proteins for supporting our tissues and for the enzymes that are made of proteins. So we end up with systems that cannot function properly. And when we're looking at the immune system, which is very highly dependent on zinc, the immune system doesn't function very well at all. So the immune system requires zinc, and there are many studies now to show that just zinc supplementation can reduce inflammation in the throat, reduce the current rates of colds, reduce the severity and duration of colds, and many other viral infections as well. It also protects us against bacterial infections. So it's again, a non-specific defensive agent like the vitamin D and the vitamin C. I'll just explain two aspects of the immune system. We'll come back to the zinc in a minute, Molly, but there's the innate immune system that we inherit. There is the acquired immune system, that part of the immune system where we actually get an infection or receive a vaccine and we produce antibodies. That's acquired immunity. That's afterlife. The innate immunity is what we're born with. We develop that in the womb. And as soon as we're born, we're exposed to viruses and bacteria. Our innate immune system starts producing antibodies to these. We also receive antibodies from our mother's breast milk, which protects us. Now, there's a close relationship between the innate and the the innate and acquired immune system. And they speak to one another. And there are chemicals produced by the innate that help with the acquired immunity. So this relationship is very, very important. And this relationship depends a lot on the nutrients that we're talking about tonight. If we don't get enough zinc from our mother during pregnancy or in the breast milk, we end up with immune problems and deficiencies of immunity, and that's when we see all of the infections that we get. So, and if our early diet consists of Coca-Cola and sweets and donuts and this sort of thing, then we're actually really stressing the immune system to the point that, okay, you've had 5 antibiotics this winter, you can expect probably 10 next winter if we don't. This is sad, you know, sad that we do so much damage to ourselves and our children, and it affects not only their immune system, but their behaviour and learning as well.
Mm. So, Ian, you mentioned that you had written to ministers and government officials. Can you tell us more about that? I mean, as a person in the community, I often feel very helpless in how I could possibly get change in our government, or get some of these officials to actually wake up and make a decision with information that isn't necessarily what they're, what I believe they're told to say or do. What have you done? You've written letters. Have you spoken to people? What sort of responses have you had from the people that are meant to be there to protect us?
Well, I know some of these people. I've met some of the senior people in the government, the federal government here. To all intents and purposes, they've ignored my letters. And I've sent them the information. I've written to the Prime Minister. I've written to the Health Minister many times. I've written to the Chief Medical Officer. I've written to the President of the Australian Medical Association, who actually trained at the College of Nutritional Medicine and should know better. I've written to all the officers of the Royal Australian College of General Practitioners. I've written to members of Parliament on both sides, Labor and Liberal. I've sent letters to the unions, including the Healthcare Workers Union. I've sent letters to some of the larger business corporations. It seems to fall on deaf ears. People think because you're advocating for something natural that you're anti-vaccination. And the issue here is the emotional side of the vaccination. Now, I'm not going to get into that debate tonight, but everybody is waiting, well, no longer waiting for an effective antiviral agent, because the most recent antiviral agent that's been taken up by the United States costs $10 for a course of the drug, but it's being sold for over $4,000 US. So that's the most recent antiviral. The other one was hydroxychloroquine, which in sick people at high doses will kill them. In the early stages, low dose probably helps them. So we're left with the vaccine, and we're not going to have a vaccine for quite some time, although there are 100 or more companies around the world experimenting with vaccines, and usually the recovery rate of that is around about 5%. So there may be 5 or 10 companies that actually produce a vaccine. Whether it's safe, whether it's effective, I don't know. We don't know. We know that the vaccines that have been manufactured for SARS in the past have had serious side effects, very serious side effects, not only when they've been given, but also when the person's been exposed to the wild virus after the vaccine's been given. So I hope that they will come up with some safe and effective vaccine for the majority of people who want it. But I also believe that there should be an opportunity for those who want to achieve wild virus immunity through the use of the defence mechanisms that we're talking about tonight, CD and Zinc, that we can achieve some degree of relief from this virus. I also point the finger at the research establishment and the clinical establishment, who've ignored all of the literature and the science to do with vitamin C and D and zinc. They are culpable. They should have been doing work on this, because it wasn't a matter of when the pandemic was going to hit us, but it's a matter of, sorry, not a matter of if, but a matter of when the pandemic was going to hit us. And my question is, they're getting closer and closer. You know, we've had SARS, we've had swine flu, we've had MERS, we've had bird flu. The next one may not be the dress rehearsal. And how far off is it? With this current one over the last few months mutating, virus mutating at least 7 times, is it going to be less potent, less virulent, or is it going to be more virulent? We don't know. But we've got to be prepared, and we fail. We plan to fail because we failed to plan for this one. We know. And we've been pretty lucky here in Australia. You know, we got in early. We didn't get in early enough. And we had, of course, the Ruby Princess caused most of the trouble. But we've been fairly lucky. We'd come out of summer when it started here. And so I think a lot of people probably had reasonably high levels of vitamin D. We don't know for immunity to it. You know, we're still testing for active virus, but we don't know accurately how many people have had it, how many people have been walking around who are asymptomatic and carrying the virus and actually now have their own acquired immunity to it. But I do believe that if we could implement a program over the next 4 weeks, starting in 2 weeks' time, to achieve a defence for everybody in the country, simply by the government putting its hand in its pocket and not spending billions of dollars on some of these other programs, but perhaps $500 million at the most in giving everybody CT and zinc and educating the population about how to defend ourselves. Because we're talking about a couple of $100 billion to defend ourselves from a military point of view. We've got to have our own internal defences as well and protect our people and our public, and especially those who are vulnerable and high risk in the community. And it's just not my opinion. One of my colleagues in the UK works in Harley Street. We agree that this could be turned around globally in 6 weeks. He believes it could be done in 4 weeks. I'm a little bit more pragmatic. You know, things don't work that fast. But you know, I even made inquiries with the vitamin industry. Do we have enough vitamin C and vitamin D in the country? And the vitamin industry said yes, and we can ramp it up. But we're dependent on importing our vitamin C and vitamin D from China. So we've got to stay friendly with China as well. But in Wuhan, I've been to Wuhan probably about 25, 30 times professionally. I've got colleagues in the US who work with the doctors in Wuhan. And when it broke out in Wuhan, there was a couple of truckloads of vitamin C taken into Wuhan and used. The doctors were using vitamin C intravenously there and getting very good results. I think the Chinese have a culture that's a little bit different to ours. You know, they do traditional Chinese medicine, herbal medicine that you would appreciate. So they will use anything that they see that works. They won't wait for a particular population of people with COVID to test vitamin D and take 6 months to 12 months to produce a paper that's published and so, oh well, we discovered something. It's already been discovered. But, I think we've got a lot to learn, and our authorities have got a lot to learn, and they've got to open their minds up. Otherwise, when it comes time for accountability, who's going to be held accountable? Who? Is it the World Health Organization?
And that time will come, Ian, I think. I think there's such a lot of disharmony in the community around and distrust with our authorities. It's coming.
Molly, I know that my information got through to the task force in Canberra because my local member actually told me that my letters were getting through to the Health Minister, the Chief Medical Officer, and the others there. But did they bother to communicate with me? No. Did they bother?
It's very disappointing.
Well, it's a disgrace because is this a democracy? Are we all included? And it's not as if I'm not known by them.
Yeah.
They know.
Yeah.
And it doesn't matter to me, but you know, it's another person may regard it as an insult or an offence. How I see it is it's a very sad situation for humanity when our leaders don't listen. All they listen to is the information coming from a particular sector of the medical profession who just don't believe in natural health care, who have not any training in it, but make decisions about it.
It doesn't make sense.
No, it doesn't. Well, when you consider that there are possibly trillions, but at least billions of dollars being poured into vaccines, and the amount of lobbying that goes on from the big they make sure that the advisors are getting their advice, so that the leaders can make decisions based on biased advice. And we also have a media in the country that's also very biased, including the ABC.
Yes.
It's a very biased media, and there's so many. I mean, I've only met one or two really honest journalists who really want to get to the truth of the matter. One of them was with the ABC, and her show was shut down. That was Catalyst, and she exposed the truth about statins. So we don't, as it's been said in the past many times, the first casualty of war is the truth.
Yeah.
And somebody else once said, the only way to deal with a pandemic is the truth. And, you know,
we're not seeing a lot of that, Ian, are we?
No, unfortunately. No. But I think we've been pretty lucky. I just feel very sorry for those who've lost their loved ones, because they could have been saved. There are doctors in the US, there are doctors in some of the Middle Eastern countries, and there are doctors in China who are giving intravenous vitamin C and getting very good results. Saving lives. But yeah, the intensive care specialists here refuse to give intravenous vitamin C because there's been some successes, and they don't want to admit that they've been wrong.
Yeah, yeah, there'd be a lot of that, wouldn't there? Yeah, definitely. Ego and yeah. Yeah, it's very distressing. I find it very distressing.
Well, there's some light at the end of the tunnel. We just got to shine it on the powers that be, or change the powers that be. Change them.
Yes. Change. We need change. I agree. I couldn't agree more, and I think probably most of the population agrees as well.
Well, when you consider that the cause of death in Australia and America, one of the top causes of death is iatrogenic. It's physician-induced. It's the wrong diagnosis, the wrong drug, and this is a fact of life. And we estimate in integrative medicine that 80% of people would be far better off if they reduced or stopped their medications and went on a number of different vitamins and a slight change in diet and went for a walk. Or got a pet. You know, it's easy to write a prescription for a pet. A friend of mine does.
Yeah, it's well, the whole system would collapse. There's so much money involved, isn't there, in medicine and healthcare?
There is, and I mean, we've all got vested interests in it. I mean, if you've got a superannuation fund, more than likely the superannuation fund has got shares in drug companies, the most profitable companies. So we've really gone down down the gurgler, big time.
We need a reset. Everything needs to be looked at and reset. Every country around the world.
Look, I agree. And I think the force is not going to come from the powers that be or those who are experts. The force is going to come from the public, who become more and more informed.
Yes, absolutely. Couldn't agree more. Ian, let's move on to some of the questions that people have sent in, because we've got quite a few of those. Now, the first one was, if you contract COVID-19, what is the best course of action? I think we've probably covered that, but is there anything you want to add to that?
Well, hopefully, if you contract it, it's only going to be a sniffle or a mild cold, because you would already be taking vitamin D, your vitamin C, and your zinc. If you haven't been and you contract it, then you go straight onto it. I'd go and get my vitamin D levels measured. The government, in its wisdom, stopped rebates for vitamin D testing some time ago. Doesn't make sense, but
go figure.
Go figure it. And if you're low, you might need to go up to 10,000 units a day, but do it under the care of somebody who knows what they're doing. If you start getting a cough, be careful. If you start getting short of breath and you think you may need to be hospitalised, the first thing you do is get some intravenous vitamin C from a doctor who gives it, or increase your dose of vitamin C to 10,000, 20,000 milligrams per day, or until you get loose bowels, or until you feel better, improved. And if you get worse and you start coughing, you've got a fever and you've got shortness of breath that's not being relieved, and you'd be admitted to the hospital, I'd demand that the hospital start giving you some intravenous vitamin C. And if you're low in D, they can give you an injection of vitamin D, a bolus dose, maybe 50,000 units or even 300,000 units, depending on levels. And of course, you're taking your zinc as well. And you stop sugar, white flour products, alcohol, and anything with chemicals in it. And, you know, get really into your fresh fruit and vegetables, and perhaps oily fish in your diet. If you know somebody who's going in intensive care, you'll get pushback from the intensive care specialists. My suggestion to people is you may need to seek legal advice in that situation, and have your lawyer talk to the lawyers and go by the doctors. And I don't mind speaking my mind here, because some of the doctors have seen people's lives saved in intensive care. There's a couple of 60 Minutes reports from New Zealand from about a decade ago, where a gentleman was going to be taken off life support after being on it for 6 weeks. He was unconscious, he had lung whiteout, he had renal failure, and also had hairy cell leukemia. And the doctors over there refused to give him the vitamin C until the family went to the lawyers. The lawyers insisted on it being given. And in 3 days, his lungs started clearing, and he was taken off ECMO, the life support. He's still alive today.
Gosh.
Experts around the world said this gentleman had no chance of surviving. And still, the doctors who witnessed that don't have a level of inquiry that I would say should be there for somebody who's been scientifically trained. Very, very, very sad.
Shameful. Shameful.
Yeah, it is shameful making judgments about people who should know better. But that's the situation. If you give an oxygen, then you need a lot of vitamin C, because the oxygen produces oxygen radicals, free radicals. And if you put on a ventilator, then your relatives should start praying hard, because the ventilators actually increase the risk of death. Mechanical ventilation, putting a tube down. That's when you really do need very, very high doses of vitamin C intravenously. You may need 50,000 milligrams, but more likely you're going to need 100,000 milligrams. And, you know, when you really get to a point where, you know, life is almost finished, and you should never get to that stage, doses of up to 200,000 milligrams or 200 grams have been given.
Wow.
Over period. I mean, I was told that if you give any more than 100 milligrams, you know, this is by the so-called medical experts in this country who train a lot of doctors, you're going to cause kidney damage. Well, 100 milligrams is nothing compared to 100,000 milligrams. And
yes.
you don't see the renal damage that they claim will happen. You've got to be cautious, but I'm sure there's plenty of fluids going in. But I think the message has got to get out there, and if the Health Australia Party can keep pushing this message out, that there has to be change, and these people in powerful positions who are responsible for people's lives need to look at the experience of those who've actually been out there and become experts in vitamin therapy. You know, we can go to a doctor and with a migraine headache and ask the doctor for a herbal medicine because he wouldn't have a clue. He might look up a little book and say, I can give you fever fuel, or I'll give you something else or whatever. No, you go to an expert, people with experience. And this is what happened in Wuhan in China and Shanghai in China and other parts of China. They give the orthodox treatment, the mainstream medical care and drugs to the COVID patients, but they also give them vitamin C and other nutrients, and they also give them traditional Chinese medicines.
Yeah, exactly.
So,
as it should be, combined therapy.
Combined approach, absolutely.
Okay, the next question, Ian. A doctor in the US, an ICU doctor, has said the treatment is wrong for COVID. as these patients don't have pneumonia but seem to be presenting with symptoms as though they have altitude sickness. What's your thought on this, Ian?
Well, it is like an altitude sickness. It's not a classical pneumonia. What is happening, and it's only been recently discovered, that these free radicals produce stickiness of the blood, and the blood becomes very sticky, and the blood that's circulating around the air sacs in the lungs, the blood circulates around the air sacs and picks up the oxygen and gives off the carbon dioxide, so you breathe off carbon dioxide. That blood becomes very sticky, and those little arteries called arterioles around the air sacs, the lining becomes hyperoxidated, it becomes damaged, and so free radicals are formed there, and it causes stickiness of the blood, and that blood, when it becomes sticky, forms little clots. So the air sacs are surrounded by clotted blood, if you like. So it's not a classical pneumonia where the air sacs fill up with a whole lot of white blood cells and become solid. This is why they give these patients heparin. Heparin is an anticoagulant to stop the blood getting sticky. What else stops the blood getting sticky? Vitamin E, vitamin C. Vitamin C,
yeah.
You know, so you give it before all of that happens. And you can give other things to stop the damage to the blood vessel walls as well. I won't go into that tonight because I want to try and keep it very simple. You still give your C, Zinc, and let the doctors give you heparin in the hospital. And the other thing to stop the inflammation that's been shown recently is a cortisone substance called dexamethasone. And I don't have any objection to heparin and or dexamethasone. They're very, very important in these circumstances.
Okay.
Dexamethasone,
thank you.
Cortisone is a natural substance, and heparin is a natural substance that comes from the liver. So it's natural.
They're all natural. Okay, next one. What is the difference between the coronavirus that basically causes the common cold and this variant called COVID-19?
Good question. Hard one for me to answer. I'm not a virologist. My understanding is that the spike proteins on this coronavirus are different in terms of their mechanisms of action, and they actually, I think, have an effect on the ACE receptor, which is the angiotensin converting enzyme receptor of the cell, and actually just damages the receptor, and that damage allows it to enter the cell. And the ACE receptor, the angiotensin converting enzyme receptor, is one of these receptors involved in blood pressure regulation. So people on ACE inhibitors, where these inhibitors actually allow the formation of more of the receptors, because there's more receptors there, more viral particles can actually enter the cell. That's my understanding of it. And that's how it's different. And the spike protein produces some sort of an enzyme that's unique to this particular COVID-19 virus. And probably because of some mutation.
Okay, there was a question about using ventilators, but you did touch on that it's the wrong treatment.
Well, I would prefer, with our techniques, to let all of us know now what we would do. We would not get to the stage where we need to go into intensive care, and preferably we would also not be in a situation where we need to go into a hospital. But if you have to, then the intravenous vitamin C should be started straight away. We're actually designing a study at the moment to follow these recommendations, but I can't tell you much more about that at the moment.
Sure. Okay, but that's great. Now, next one. Why do hospitals get paid for certain diagnoses? For instance, in the US, the hospitals get $39,000 for each patient that uses a ventilator. I believe this does also happen here in Australia. To me, it sounds like a conflict of interest to the true cause of illness or to the correct form of treatment. Can you share your thoughts on this, please?
I don't know.
Don't know, okay.
I really I really don't know. I mean, I've heard things along those lines, but I don't know any detail, and I would only hope that that sort of thing doesn't happen, but I can't say much.
Well, I don't know. Okay, next one. What are your thoughts around wearing masks?
Again, that's controversial, but if you've got good masks, it does help to reduce the spread. If you've got COVID and you're breathing out or spitting out particles with the virus in it, and you've got a mask on, there's much less risk of those particles getting into the environment. So if you've got active illness, definitely wearing masks is important. If you are asymptomatic, but you've been shown to have the virus, then wearing the mask is important in protecting others as well, because even when you speak, you're spitting out the particles of virus in the saliva. So certainly with coughing, absolutely. I mean, if you are symptomatic, reside at home until you're over the infection. Wearing masks for protection is possibly a scientific, but there's conflicting evidence. But certainly, I think in places like Hong Kong and Taiwan, masks were used, social distancing and hygiene, cleaning of the hands and other forms of hygiene were strictly adhered to right from the beginning, because Taiwan had experienced SARS and it was serious, and they knew exactly what to do when Wuhan announced this virus had leaked out and causing problems in Wuhan. So Taiwan shut down immediately. Taiwan is the island off mainland China. And I have colleagues and friends there who I know, and basically they didn't shut down. They kept on going because they knew what to do.
All right. Thanks, Ian. Sorry, is there anything more there?
No, that's fine.
No? All right. What do you do if you have a vitamin C allergy?
No such thing.
No such thing? No. Okay.
No. If somebody is saying they've got a vitamin C allergy, maybe vitamin C made out of sugar cane, or it may be made out of sugar beet. There may be residual bits and pieces of things from the sugar cane and or the sugar beet that they're reacting to, but the amount in the vitamin C will be neutralized by the very powerful anti-allergy effects of vitamin C. The best thing for an allergy is vitamin C. So what these people who say that they've got allergy to vitamin C probably suffering from is an early commencement of a detoxification program that the vitamin C is initiating. The vitamin C stimulates the immune system to become more active. It stimulates the liver to be more active and the enzymes in the liver to be more active. So what it's probably doing is helping the liver to clear out substances that have been residing in the system for a long period of time. And it's like a dirty old pipe. You get a pump at the dirty old pipe and pump all the rubbish out. All of a sudden you've got rubbish coming out the other end and causing a mess. Well, it's similar to this. You're actually forcing the liver to pump a lot of rubbish into the gut, into the bile, and your system is having a reaction to it. So what I say to these people, take very small doses and very frequently over a period of time, so your system gets used to it, and you're not forcing all the rubbish out of the pipe all at once, but you're just slowly pushing it out. So at the other end, you can cope with the rubbish and disposal of it.
Okay, so crawl through the pipes, I guess. Yeah, okay. The next one, do you think COVID-19 was a man-made virus or naturally occurring, somehow jumping from animal to human?
Jumping from animal to human. I don't think it's a man-made virus. There's very little evidence for that. I mean, yes, man is making viral particles. We can do that. We can make parts of viruses, but the evidence is not very good evidence from what I've read
And it's more likely, if you've seen the wet markets in China, I've seen many, many wet markets in China, and you know, there are so many different animals and animal parts all being mixed up together, and there are live animals and there are dead animals. It's so easy for a virus in that situation to jump from one species to another and then to a human being. I mean, when you talk about a wet market, it's wet, wet, wet. It's wet with blood, and it's wet with pieces of animals, and you know, there's a chopping block here, chopping off some unusual animal, and another one over here. But that's the Chinese culture. It's always been like that. It's just that the villages, it was small. Now we've got these huge cities with these huge markets. There is a very slight opportunity for a virus to, you know, say, okay, I've adapted to this particular animal, but that one over there is looking pretty good. So, you know, there is an opportunity for mutation.
Give it a burn.
So, you know, it's gone from one little animal, probably from the bat to the animal that's a bit like an anteater, and then and the evidence for that is strong.
Okay, thank you. So someone said, assuming vitamins and herbal medicines will help, is it good to take them on to daily, or just wait till when you get some symptoms? And I think you're saying take it daily, take stuff, protect yourself all the time. Yep.
There's no good scientific evidence to say that you live a normal life in this country that you're going to have the right levels, the optimal levels of vitamin D. There's no evidence. The evidence is that you're going to be low or deficient, especially during the winter, and especially if you're overweight, and you know, and the other risk factors. If you've got darker skin, you're certainly going to be low and or deficient. And what is low or deficient depends on your definitions. But what I like is this is low and this is high, and I like people to be up here or even a bit higher, providing get to certain levels that we know in the lab. 80 to 85 nanograms per milliliter is one level, and another is millimoles per litre, and above 130, 140 milligrams is the other measure. So it's important that we be scientific about the vitamin D. Everybody needs vitamin C. You don't have to worry about testing for it because there aren't any reliable tests. The best test is vitamin C. That's very
okay. That's the dog. Oh. Sorry, having a coughing fit. Do you want to take them out? I'll open the door. Sorry, everybody. Now, another question. Can vitamin K2 be taken while supplementing with D3?
Of course.
Or should it? Yes. Should it be taken together?
What way would you be taking it? Number one, for bones, and number two, for the health of your coronary arteries, and reducing the calcification in coronary arteries. I think K2 is a very useful vitamin as well. It's a fat-soluble vitamin like B. So if you've got a really good reason for taking it, yes.
All right. Now, Etta said, what about the mandates of flu vaccination to visit the aged in nursing homes? That must be for for people visiting people. How do you think that's reasonable, I guess,
Look,
to protect the elderly?
The more flu vaccines you have, the more likely you're going to have a bad coronavirus infection.
Okay, so
you've had half a dozen flu injections, your immune system, in some people, possibly many people, will have a bad reaction to COVID. So I'm not supporting the use of mandated flu vaccines. I would prefer people to do the program that we're talking about, but more importantly, for the hospital or nursing home or the institution, to be given their vitamin D and vitamin C and their zinc. And that's the best way to protect them, and also give these people an opportunity to go out in the sun, even in the winter, when the sun's at its zenith, and expose 20% of their body or their skin the sun rays.
Mm.
Putting blockout on actually stops the UVB getting to the skin, so blockout's no good.
Yeah.
And vigorous, I don't know how good this science is, but the vigorous washing of the skin with soap after being in the sun may wash out off some of the cells that have actually produced the vitamin D. So, I don't know how good that science is.
Something to research, Ian.
For certain populations that don't wash very often and who live in a not a sunny climate, it's probably a good thing not to do.
Okay. In Victoria, the numbers of COVID positive patients is growing, and as the government is paying $1,500 to everyone who has a swab done, so of course lots of people are lining up, and of course the numbers will escalate. And it says it doesn't make a lot of sense to me, as most people are clearly asymptomatic and not ill. So do you understand why there's a purpose in this?
No, I don't. I really don't. And I think it's the situation has been absolutely chaotic right from the start. And the science has been chaotic, you know, arguing about social distancing, how far apart, washing hands, masks and so forth. And decisions are being made on the hop. Fail to plan, plan to fail. I mean, that's the story. And it's working within chaos and making decisions to do something that's causing a lot of this. Yes, the social distancing, the fence ringing, ring fence or whatever they're calling it, the hygiene, all of these things are very, very important. But paying money for people to do tests, it's just more waste. Waste is what we're seeing. Huge amount of waste. Wasted lives, wasted businesses, wasted economy. And there are better answers. And this is what makes me very, very frustrated, very sad, and very angry that these sort of activities are occurring. I mean, I wrote to Daniel Andrews at the beginning. I mean, there's not too many people I didn't send a message to. And, you know, it's sort of like it falls on deaf ears, you know. This guy must be a crank. You know, what's vitamin D? You know, it's just, you know, vitamin D is what you get from the sunlight. How can that prevent? You know, they don't understand that the stuff actually goes into the cells of the immune system and facilitates the production of antibodies. That's simple, you know. They just, I mean, a lot of these politicians are so poorly educated. So
yes, agree.
In fact, the entire population needs educating with regard to self-help and self-health care, and not relying on a disease care system, which is very, very good when you need it, and should only be treating people who suffer from trauma. We shouldn't be having most diseases that we're faced with. We can prevent them. But as I said before, we're on a fast train to ruining the race. And
it's quite scary, isn't it?
Well, they need to wake up. This is just a dress rehearsal, you know. And it's not me saying that. You know, virologists have been telling us about the coming pandemic for a long time. Even Dr. Professor Bill Gates was telling us about it. He got that message from better educated people than he. You know, we know what's going to happen, and we know that it's going to happen because the environment is suppressing our immunity. You know, there's so much documentation about that. One of my colleagues in Melbourne wrote a paper about pollution, and the closer you live to a freeway, more likely you're going to have heart disease, lung disease, strokes, and possibly many cancers. And it's the closer you get, the more likely you're going to get these disorders. And that's just one aspect of our environment. You know, so,
and there's many, isn't there?
There are many. You know, we're full of chemicals and pesticides, heavy metals and residues of these things. You just test the fat and test the blood, you find it. You do a hair analysis, you find everybody's got lead, arsenic, cadmium, mercury in their systems. You know,
it's a wonder we're all walking around, really, isn't it?
We're pretty resilient. We're
Yeah.
pretty resilient,
Yeah.
but
Yeah.
the more resilient we become, sometimes I think the more insane we become.
Yes. Blasé, perhaps.
Well, blasé, or living in a toxic environment. I remember reading Rachel, what was her name? The Silent Spring, back in the 1960s, Rachel Carson's book. It was scary then, and hasn't improved. It's got worse.
Mm. Well, you have to wonder where we're going.
Well, your listeners, I mean, it's very important for your listeners to talk to other people about this. And, you know, I think the more we try to get messages out, the better off we are in the long run, because if we keep polluting the environment at the rate we're doing it, there's going to be more and more disease and new diseases. We're seeing new diseases, mutant type disorders and cancers that are becoming more malignant, difficult to treat. And the canary in the coal mine, or the canaries in the coal mine, are our children. And it's being reflected in behaviour disorders, learning disorders, ADHD, autism, and the increasing neurological, neuropsychiatric conditions that are affecting our children.
Well, we have to wake up and learn, make changes, make a difference.
Yeah, I agree. And I think changes to government policy is very important. I delivered a National Press Club address in 2002, and I've got it on my system here. And I was talking about it back then. Was there any policy?
20 years ago, basically.
Yeah. Was there any change?
No. Well, let's hope we can start a new path, Ian, and actually get some change.
Well, I hope the Health Australia Party can, get bigger and stronger. Because there's no political party in this country that are focused on health. I mean, the closest party to health are the Greens, and that's basically look at the health of the environment. The overall health is not considered. But health.
Yes.
Health is health of the environment, health of the individuals, health of the economy, and health of business, health of all of our activities.
Exactly. Yeah.
We should have our health.
Health for all.
Yeah.
All right. Well, Ian, on that note, I'd like to thank you so much for joining us tonight and imparting your wisdom with us. I've learned quite a few things, so I thank you for that, and I'm quite sure that our audience will have glean some good information, and so hit the vitamin C, the vitamin D and the zinc and get us through winter from anything, basically. Thank you, Ian. Much appreciated.
You're welcome. My pleasure. Good night, everybody.
Good night. Good night.